Hello, and thank you for joining us. This is No Soundbites Allowed. I am your host, Michael Voss, Dragon of the Southern Tier. I am happy to be here with you today. Well, it's an interesting day. It's a difficult day. It's September 27th. It's currently 7 p.m. There is breaking news throughout the news media across New York State. Many people may not be aware of this, but today, approximately, as best as I can tell, 45,000 people were just fired. 45,000 doctors, nurses, and healthcare workers just got the boot in New York State because Governor Kathy Hochul decided that they just can't work anymore. And this may well be a violation of their rights in terms of the Constitution, in terms of our laws across the state. And I want to hear what you have to say about all this. And I want to hear your comments, folks, because this is very important. And I want you to know that you can reach the show. You can either contact us on YouTube, Facebook, Twitter, and leave your comments, also on DLive, or you can call in at 607-242-1582, especially if you are a healthcare worker, especially if you have just been notified today that you lost your job. Now, the reason why I'm doing this today is I've received several calls throughout the day. I have been notified in my local region, in the Southern Tier region, of some extreme measures that are being taken. In fact, I had to call to my chief of police, the Binghamton chief of police, Chief Zukoski, and I spoke with him just about an hour ago to confirm information that I had received that is incredibly disturbing. I had to actually speak to him, and I got him on the phone, and I spoke with him directly to find out whether or not the rights of American citizens were about to be violated by a private business, a hospital in our region, because of what Governor Hochul has done. Now, let's try and put this all together here, because I want you to understand not only what is happening in a real-time context, but also what are the consequences of what she has done and how it's going to affect your life. And again, this is open to everyone. If you're a healthcare worker, please, you want to talk about whether you have your job, you don't have your job, please let us know. Obviously, as people know, I have been the only news media in the Southern Tier of New York, besides the Bill Houston podcast, and myself are the only ones who have covered every one of the vaccine mandate protests that have been going on in our region. The major news media have ignored this. They have ignored letting the public know and prepare for the onslaught of the problem. And if you don't think it's a problem, 45,000 people just got fired. That's 45,000 people in one state in one day. When we had 11,000 people fired on the day that Joe Biden took office, we saw and continue to see a national increase in the cost of gasoline and heating oils. So if you think there's no impact from all these people suddenly not having a job, oh my God, wait until we go a little bit further. Now, I want to give you some actual data here so that you can see this for yourself. Earlier today, we saw that New York Governor Kathy Hochul says that she will deploy medically trained National Guard troops to replace unvaccinated healthcare workers in hospitals who will be fired tonight. That's because Kathy Hochul has decided she wanted to play hardball. She wanted to make sure. She wanted to take a picture out of history, and she thinks she may be something like Ronald Reagan. This isn't 1981. This isn't the air traffic controllers. This is doctors and nurses and people who need medical attention, not just because of the pandemic, but for everything. Did you break your arm? Did you get in a car accident? Did your kid fall off of a ladder? Did you get food poisoning? Are you allergies? There are 1,001 medical issues that happen every day. We're talking about my local region of the Southern Tier alone. In each of the facilities, that would be UHS and Lourdes, Binghamton General, you're talking about 100 people a day on average go in. not because of the pandemic, but they need help. Hang on. Vic, hang on 1 second, folks. 1 second. Vic, you gotta call into 607-242-1582. 607-242-1582 so that people can hear you, okay? All right. So, again, I'm happy to have anyone call in, and we'll be able to hear you in just a few moments. Now, again, that's 100 people a day that are calling, that go into these hospitals that are underfunded because of what Kathy Hochul has just said. Now, I want to put this into perspective. She came out and she said that on September 27th, it would be mandated, it would be a requirement of every hospital and every medical facility, nursing homes and so forth, that everyone, including people like in nursing homes, people who are dealing with drug addiction, everyone is going to be under this guideline of hers where she mandates, where she has decided, taking a page out of Andrew Cuomo's book, that she, Empress of New York, decided that everyone has to be vaccinated. You have no choice. Now, judges absolutely disagreed with that. Judges said, no, this is not the case. And by the way, I will get to the comments in just 1 second, but I just want to set the setting here. So we had judges on September 14th, right after she said, this is what you have to do. You have no choice. You have no freedom. Federal judges in Utica came out and stated and put in a stay, and they literally forced New York State. They said you cannot cause people to be fired because they have a right, a constitutional right to choose. And you cannot fire them for this reason. Governor Hochul said, nope, that's okay. She said she's going to continue because it's about protecting New Yorkers and combating the Delta and increasing the rates. By the way, we're at 75% of vaccinations. Remember back in January, it was Joe Biden, he said we needed to hit 75% because then we would hit herd immunity. New York State has 75%, and we are at herd immunity according to what we were told, but that's not good enough. Now it has to be 100% vaccination. Whether you agree with it or not, the consequences are that a judge said you can't make it 100%. People have the right to choose. And then he went even further and said there was a selection because of a union workers were exempted, which is really funny. So everyone in the New York State, all the healthcare industry workers have no exemption except for if you have a religious exemption. So again, this is going until October. No one is supposed to be fired. No one in New York State was supposed to lose their jobs today. And yet, that is not the case. And the only people that had a full-on exemption and won their case happened to be the labor union workers of CSEA. They were the only ones. The Civil Service Employees Union were the only ones to get 5,000 people to save their jobs. Okay, so let's get to some of the comments here, because that means that 40,000 people lost their job today. 40,000 people who take care of you. That means there are no doctors, nurses, and the impact is incredible. As I understand this moment, there is an understanding that one of my local hospitals, Binghamton General, may be closing. The hospital may be closing. Definitely, their psychiatric wards are shutting down. Individuals who have serious mental issues. This is full capacity wings. They're completely full, are going to shut down. And those individuals, where are they going to go? Because there is no other facility to take care of them. I have already seen, and I can show you, and then I'm going to go to the comments here. But I want to show you some of the information we're talking about here that Kathy Hochul has done, that we are seeing hospitals across the state do. So one of the things you see is Lourdes, UHS, they say, oh, we have a plan. We have a plan that they have put in place. Their plan was fire people. In Bassett Healthcare, 200 workers gone. Willow Point, a nursing home, has lost their staff. They're at I believe it's 60% of staff are available. We see that, where is this? I have here it is. The Erie County Medical Center in Buffalo said they've lost 5% to 20% of its staff, including nursing homes. We are looking at, in every part of this state, people have been lost. I have even received information directly, and I won't show this. It's a source that requested to be unnamed, although other news media also referred to this same source today. WBNG in particular, a news station, they also use this. Lourdes Hospital is cutting back on its phlebotomy departments. We have Owego is taking down their phlebotomy departments. That means if you need a blood test, there's no one there to do the blood tests. Their staff is essentially shut down. The outpatient facilities are going to be shutting down over at Lourdes Hospital. This is where they get about 80 to 100 patients a day because they don't have the staff. You're looking at the post-surgical, like in Syracuse University, which cut from 35 surgical units to 22, cut out 22 of them. Well, that's happening here in the southern tier as well. And I see nursing homes, Willow Point is down 40% of their staff. Binghamton General Hospital, the psychiatric ward, I just mentioned it. Delaware Valley hospitals are temporarily suspending any admissions. No one can go in there. F.F. Thompson in Canandaigua, Krause Community Center in Morrisville, New York State Veterans Home in Oxford. There is no one who's being missed. No one is being missed. And you have heard from Broome County Executive Jason Gunnar. There's a plan. They're working on a plan. You heard from Kathy Hochul. There's a plan. Yeah, the plan is to get National Guard workers to come in. How many of them are there? How fast will they get in here? Because guess what? We know for a fact, it is a fact, as reported by the Dallas, where is it? I want to make sure I show this to you. The Dallas Morning News. There are 1.7 million job openings for doctors, nurses, and healthcare workers. We have almost 2 million people short to start with before today. Where are they getting the doctors from? Where are they getting the nurses from? We don't have enough doctors and nurses and healthcare workers to start with. We're down by 2 million. We're already short 2 million in this nation. And Governor Hochul is saying, well, I'm just going to get doctors and nurses from another state. Why? How? Where are they coming from? We don't have them to get them. No one has a surplus. We are short 2 million healthcare workers right this second in the nation. And New York State just added another 40,000, maybe 45,000 individuals to that list. And you're telling me you're just going to find a bunch of doctors? From where? Where are these people coming from? And by the way, she dropped her language, which she was saying over the weekend, that she would get them from other countries. She doesn't have that power. She can't do it because they can't just walk into this nation. They're not accredited. They're not qualified. You can't come from Venezuela, come to the United States and be a doctor. It doesn't happen. You have to start over. You have to retrain. So she doesn't have these people. Let me get to some of the comments because I promised I would get to it. And I know I'm very upset about this because there are thousands of people per day just in the southern tier that are going to be hurt by this. There are people who are going to die of opioid overdoses, people who are going to relapse into their addictions, whether it be alcohol or drugs. There are going to be people in nursing homes that are going to die. There are people who are going to not get surgeries that they need to protect their lives. We're talking about cancer patients aren't going to be able to get their chemotherapy. We're talking about diabetics will not be able to get their treatments that they need for their kidneys. Thousands of people are going to die because of Governor Hochul. And her answer is, I'm just going to get the National Guard. Someone else will show up. That's just stupid. That's not planning. That's not leadership, in my opinion. But let me get to the comments here. So, Teresa mentions that this is a bunch of BS, a violation of our constitutional rights to do this to individuals. Star Raptor mentions that the once heroic essential workers are being thrown out like trash. We see that watching trains go by. Hello, good to see you again. I'm not sorry for these. She's saying that she is not sorry. Many being fired help promote lies and agendas while laughing and TikToking, generally dancing on social media. They won't go along and end scene LOL wrong. Okay, so there's one individual who thinks that doctors and nurses are getting what they deserve, watching trains go by. I disagree with that. I disagree with that very strongly, because what if you happen to be, and I want to answer this question. I hear it a lot during the protests. People are talking about it with me about the protests that we've been seeing for the last several weeks. And they say, well, no, this is simple. Just get the vaccination. What if you have medical reasons that you can't get the vaccination? Maybe you're allergic to the vaccination. Maybe it interferes with other medications that you have. Maybe you're a cancer patient and you can't get the vaccination. It would actually kill you. What about individuals who have a religious reason why they won't take the vaccine? And so they can't. They believe in their God and they don't want to have the vaccination. What about those individuals? What about people who just don't? They're Americans and they choose not to because their health care is their private choice. And that's why we have a Fourth Amendment. Do none of those things apply? I would ask that of watching trains go by. Doesn't that apply? And more importantly, and as we speak about that, that's a question. And at the same time, that doesn't resolve the fact we just lost literally 10% of all the doctors and nurses in this entire state. And that means millions of people are potentially affected, definitely thousands every single day. We need to resolve that. And Governor Hochul is saying, no, I'm going to play politics because that's more important. Jordan Salisbury says that 75% is the number of people with one jab. That's correct. That is 75% of New York State have received at least one dose. Some of the medications do allow you to have one dose and that's all you need. Some require two, some require boosters, but that's not everyone. But that's 75% of New York State that have received it, which is herd immunity. That's what we were promised in January. That's not what they're saying today, but that's what they said in January. So I don't understand. Again, how can I trust the government and what they're saying when the goalposts keep changing? And again, that doesn't address what about people with medical and religious reasons why they say they cannot take this. There are no exemptions. There is no excuse. If you're a diabetic and you can't take the medication because it interferes with your medications, it throws off your body and kills you, then isn't that an exemption that we should be doing in this nation? And according to Governor Hochul, nope, that doesn't count. That's kind of scary. Jordan goes on to say fully vaxxed is more like 20%. That's not correct. That's not correct, Jordan. You're talking about maybe the black, if you're looking at just the black community of New York State, that's 35%. 35% of blacks in New York State are fully vaccinated with more than one dosage of the vaccination. So your numbers are off. And that's okay because many people have these numbers off in their mind. But again, that doesn't answer the question of we have doctors, nurses who are claiming exemptions. Some of them are for religious reasons, some for medical reasons because of their personal privacy. And they just got fired regardless of what reason they have. because the governor says there is no reason good enough. Can you imagine that? So it's terrifying to me. Watching trains go by says, I don't mind difference of opinions about right or wrong, but presume to tell me what I can't do or believe. Thank you very much. I'm not telling anyone what to believe. That's not my purpose here. I'm trying to assess the situation, and I want you to understand how serious this is. We're talking about thousands of people, and I think people have a right. I believe that people have a right to make a choice, both on a Fourth Amendment basis, because you have the right to privacy, and nothing is more private than your health care. But also, I believe people have medical exemptions exist. Religious exemptions exist. So to say that, no, nothing applies, you don't have freedom and you don't have that right. I understand Joe Biden has said that on national TV, and he thinks it's true. I know that Arnold Schwarzenegger and George Takei has said that, and they believe it. But I also know that the Hippocratic Oath doesn't agree with that. And that's the reason why many people are in healthcare, to take care of other individuals and to make your own personal decisions. And what we have seen our politicians do is put people in danger. They have made it that it's a power play, essentially. You have to back down to what Governor Hochul has decided, and you get no right and freedom to make a choice for yourself. None. And it doesn't matter if that could possibly kill you. It doesn't matter if it would damn your soul to hell. That doesn't matter to her because she's the empress. That's a problem. And again, I want you to understand, this means that there are people with opioid addicts that are going to overdose and die. There are going to be people with diabetes who are not going to receive treatment and possibly will die. There are cancer patients who are going to be affected by this. There are people with various surgeries that won't be able to take them. That means that if you have an accident tomorrow and break your arm, you may not be able to get treated. Your kids may not be able to get treated because she says, oh, I want to play politics. That's devastating. And that's a reality that is happening. As I have gone through the list, and this is a list that was provided to me by an individual that has been quoted by WBNG News, and I have the same source, and we know that in some departments, including post-op in terms of surgery, we're talking about staffing levels that are below 50, 60% below what they were already at. And that was already short because over the last 18 months, look at any news source you want, our healthcare industry is understaffed. In fact, at this moment, by 1.8 million jobs. We're short doctors and nurses and healthcare workers. You think this is going to make it better? Do you think a poor person who needs to go to Binghamton General or to Lourdes or any of the hospitals, when they go and they're saying, hey, I want to go to the emergency room, and there's no one there to take care of them, or they have to wait 5, 6, 7 hours instead of waiting an hour to get taken care of because staffing levels are down, because those companies decided to fire people rather than pay attention to what the law has said. Remember, there is a stay. There are, a judge has said you can't do this, and they're doing it anyway. I mean, I can't imagine the lawsuit that's going to be coming out of this. So imagine this is what's going to be happening to you. So that's a big deal. Let me get back to some of the comments here. Star Raptor mentioned, a couple of people are mentioning that depending on your position, you're not making allies. I'm not trying to convince anyone of anything. Believe whatever you want to believe. Your medical choices are your medical choices. That's the point. Your medical choices are your choices. I'm not trying to make them for you. Nor should Governor Hochul. She doesn't have a right to make my healthcare decisions. What? She's going to make a decision about what you should weigh? Imagine if Governor Hochul tomorrow said, for the good of New York State, for your good health, you have to go on a diet. That's it. Everyone in New York State has to lose 15 pounds. I don't care what you weigh right now. Don't care about your age. Doesn't matter what your health situation is. You're going to lose 15 to 25 pounds. Everyone. And you have no choice. And you're going to have to do that. What if she said that everyone starting tomorrow has to take insulin for your health care, just for you being okay? Doesn't matter what your medical is. And you're going to say to me, Mike, those are ridiculous examples. No, it's what she is doing. And it's the same thing. And more importantly, I keep coming back to, and she just got rid of 45,000 people. That will devastate New York State in terms of its economy. It will devastate New York in terms of its healthcare quality and quantity. That's just a fact. And by the way, I spoke to Chief Zukoski today, and I want to address that and then coming back to the comments, folks. And remember, you can call into 607-242-1582, and I'm happy to hear anything that you want to say. Whether you agree or disagree is perfectly fine. But I was speaking to Chief Zukoski this evening, about an hour and a half ago, and I do know that Chief Zukoski has been notified that at least Lord's Hospital in the southern tier of New York, in Binghamton, New York, had reached out. They had made a communication with the Binghamton police. They were seeking to have police act as security guards to surround or to arrest individuals who formerly were working with Lord's until they took this action to fire a good, I believe it's close to 25% of their staff, and they fired them, and so that they cannot come back onto the premises of the building, which is interesting because you can't say that. And by the way, this is the request that Lord's made, to say that your taxes should be going to police officers so that the police officers can be security guards for Lord's because of its private decision. The answer from Chief Zukoski is that is not what the Binghamton police do. That is not what the police department is for, and that he will not do that. Officers will not be just randomly standing around the hospitals in our community arresting people because they happen to be on the premises of a hospital. I mean, imagine you can get sick. You could have an accident. You could be going for therapy or for treatment. You could be visiting a family member who happens to be in the hospital. Those things are all allowed. They are illegal. And you cannot say, well, you used to work here, so you can't come in for treatment, nor can you come in here to visit your family members. You can't do that. That's not how medicine works. So I want to commend the Binghamton Chief of Police, Zukoski, in the fact that he has denied this attempt at overreaching power in New York State, and in particular in the southern tier of New York. Lord's is out of their minds. And so I want to be clear what he did know. They didn't speak directly to the chief. I did, but the chief was aware of their request that had been communicated to him. And his answer is, that's not what the New York State Police do. That's not what police in New York State do. That's not what the Binghamton Police will be doing. That will not happen. It just amazes me that the hospital knows they're that wrong, that they're trying to get police there ahead of time to intimidate the public. Because that's a Gestapo type of tactic, to have police standing in front of your hospital saying, you can come in, you can't come in. You can come in, you can't come in. What are you, crazy? Of course they said no. Let me get back to some of the comments here. I see Jordan says that County Executive Jason Garnar said that only 15 people were lost. As I understand it, more than 15 people were lost at Willow Point, a nursing home in my community. And in total, they lost 40% of their staff, which could be 15, but I believe it's more than 15 people. So 40% of the staff were gone. Regardless of whether it's 15 people or 500 people, it doesn't matter. It's 40% of their staffing. That's the thing to keep in mind. See, politicians like to use numbers when you think to try and hide and minimize the impact of some of these things that are happening. So if County Executive Jason Garnar says, well, it's 15 people, but he's not telling you that that's actually 40% of all the staff, well, 15 sounds a lot smaller than 40%. It doesn't sound as worrying or scary. But he also left out the fact that Willow Point Nursing Home is no longer taking people in, that they're taking people who are supposed to be in the short-term care, and they're putting them into long-term care facilities. So they're getting the wrong kind of medical treatment because they don't have the people to take care of them, nor can they take in new people to take care of them like they should be. That is the understanding that I have of the situation at this time. So this is a problem. And obviously, County Executive Garnar doesn't want the public to be upset, especially not at him, for something that he didn't decide, that his party has decided. So he wants to avoid that, and he wants to minimize the nature of the situation. It's still bad. It's 40% of the staff, as I understand. Watching trains go by says that that's okay. In case you missed it, I said both sorry and not sorry. And maybe before telling others what to think, just understand what they said. I am trying to. Guthrie said 97% compliant, one of the healthcare providers in New York State. Yes, they did say that they are 97% compliant. That has nothing to do with Lourdes. That doesn't have to do with hospitals up in like Bennett. There are many locations throughout New York State. There are 45,000 people in New York State, I believe, that are being directly affected and have been fired because of Governor Hochul. So while any one of these groups will say, no, I've got 90% of my people, they're all here. Yeah, and that's great for that one hospital. What about everyone else? Because they're saying these things and you're hearing about them in the news media to make you feel better about the nature of this problem. Oh, 97% are abs. Yeah, this one hospital has 97% of its staff. They're fine. Yeah, what about the 3 other hospitals in that region trying to take care of people? What about them? What about the ones that aren't 97% that most of the poor people go to? That's the problem. And that's the magnitude of the problem. And I understand that Governor Hochul is saying, don't worry, I've got the answer. I'm just going to get the National Guard. Really? Because who's going to coordinate that? How long is it going to take Governor Hochul, who just got into the job? She just got her got a raise. She got promoted because we kicked out the last guy because he was doing the same thing that she's doing right now, acting as an empress. And so how long is it going to take Governor Hochul to organize the message, to get it out to the National Guard, get all of these people activated, turn around and figure out where do they need to go? How many people, and then figure out how many people are going to go. So say they get, say they get 50,000 doctors. Where are they all going? Who's going to where? Who's coordinating this? Who's going to pay them? How long are they going to be working temporarily? Because they have lives too. National Guard is temporary. So they have lives, they have families, they have things that they have, other responsibilities. If they're in healthcare, they're a doctor in their community. Think about this, folks. I want you to think about this. Governor Hochul said, and I want to be very clear, Governor Hochul said that she is going to go and take doctors and nurses. Specifically, I'm going with doctors and nurses, even though there's more healthcare workers than that. But looking at just the doctors and nurses that are in the National Guard, and she's going to take them and she's going to make them go work. If you are a doctor and you also happen to be in the National Guard, you're working in a hospital, presumably, or in private practice right now. If you are gone for the next month, then your patients don't have you. Your hospital that you're working at, you're not there. You didn't fix the problem. You just changed where the problem is. And this should blow some people's mind, because people are going to think, well, it's just the National Guard. She's just going to get doctors from there. Those doctors already work in New York State. They already have hospitals and patients. All you're doing is taking them from the Bronx and you're going to bring them to Endicott, New York. Now the Bronx has another doctor that they're short. Their problem is bigger. And yeah, maybe the problem in Endicott's a little bit lower. You didn't fix anything. You just shuffled it around. And God knows how long it's going to take her to actually shuffle these people all across New York State. And she has to do it immediately, because tomorrow there will be more like 500 people per day in Broome County alone, southern tier of New York alone, 500 people a day that go to a hospital every day. So she doesn't have time. That means by the end of the week, there will be 2,500 people. If we are correct, and we are seeing in this community somewhere between 25 to 40% shortages, which means that's 25 to 40% of, that's almost 1,000 people who aren't going to be treated and possibly die. That's how serious this is. I want people to understand that's how serious it is. And if they have to, and God knows how many people in New York City or in Rochester or in Syracuse, and we're going to take doctors from their communities to bring them down to ours eventually, maybe, if Governor Hochul can do that. And now, okay, our 1,000 people maybe survive and someone else's 1,000 people die. Or maybe she's going to take them from our area, because maybe there's a worse problem out in Delaware County. Maybe there's a worse problem up in Oneida County, over in Utica. Maybe she's going to take more doctors from us and put them into those other cities because they're part of the National Guard. That's the answer that Governor Hochul has provided to you. That's her plan. She's going to shuffle doctors and rotate them throughout the state. And at least part of the time, your problem will either be our problem in our community, wherever you are in New York State, is not going to be solved, or it's going to be worse than it was, because they're going to take doctors away from you, and nurses, and healthcare workers. Do you see the problem here? Because we have a government that has no idea what they are doing, and they are making it worse. And the news media isn't explaining this to you. They're not going through the severity of the problem. And the only thing they're saying is, don't worry, we've got a plan, and you have no freedom. You have no choice. The government will decide whether or not you get to do anything, because they're going to decide that for you, because the government, Kathy Hochul, is smarter than you. Why? Because she's governor. She's no smarter than anyone else. That woman's not the genius of the universe. Let me get back to some of the comments, because I'm missing them a little bit. And remember, folks, at any time, you do not have to agree with me. You can tell me, and as this, I'll just be respectful. This is about respect, but I want you to understand the nature of the problem, the consequences we are about to go through as a local community, as a state, and as a nation as this continues. And I want everyone to have that. And so I just want, you can disagree and tell me that you think I'm wrong. You can call into the show, 607-242-1582, and tell me that you think I'm wrong, if you wish. Or you can be a healthcare worker, and maybe you'll call in and you'll tell me why you said no. Was it a religious reason? Was it a medical reason? Was it because of the Hippocratic Oath? Was it because of the Fourth Amendment? I want to hear what you have to say, because the news media sure as hell doesn't want to hear you. Going back to some of the comments. One second. Here we are. Hello, and thank you for calling in. This is No Soundbites Allowed. And who may I say is speaking?
Hey, Mike, it's Jordan.
Hi, Jordan. And Jordan, are you a resident of Broome County?
Yeah.
Okay. And by the way, you don't have to be a resident of Broome County. Just want people to know where you're calling from. Go ahead, Jordan.
Right. I just wanted to expand upon a bunch of my comments there. The one with about Guthrie.
Yes.
The rest of the comment that I was making a point on there was that because, they said their Guthrie clinics are 97% compliant. However, anybody that's considered a provider, like a doctor or an RN, a nurse practitioner, they are technically employed out of Robert Packer Hospital in Sayre, therefore not covered under the New York State mandate.
They're not covered by that? I thought the only ones that were exempted were because of religious, the religious exemption that was pushed through.
Right. But if you're considered a provider, like if you go through your health insurance, right, and you look at your doctor, you're billed by the doctor, not by the clinic or hospital that you go to.
Right. So
that provider is technically based out of Robert Packer Hospital in Sayre, therefore they're employed in Pennsylvania.
Oh, okay. So that's how they're getting around it. So
that's one of the ways they're skewing the numbers.
Okay, and by the way, Jordan, I wasn't trying to pick on you. I hope it didn't come across like that.
No, I know.
And I know I'm talking as I'm reading some of the comments, so I know I was behind on that.
Yeah, and I had some comments there with typos and extra thoughts that I added on, so I just wanted to make sure they're all getting in. No. I was with you on the point of the bringing in the National Guard. Most of those people are either already employed. It's the National Guard, 2 weeks a year, 1 weekend a month.
Right.
So they're already employed. Not to mention, most of the military, from my understanding, is also going to be dishonorably discharged if they don't get vaccinated.
That would be with the officers, because you don't really have a choice as an enlisted, although they've changed a lot of rules since I was in the military, so that's different. Let me ask you something while I have you, Jordan. And this is the reason why I'm doing this live today. I was going to tape it, but I wanted to do it live. Does it make sense actually, let me ask, has any news agency that you're aware of mentioned what I mentioned, which we were just talking about, that for the National Guard, every doctor, every nurse, every healthcare worker that Kathy Hochul can pull, she's taking them out of one community to shuffle them over to another community, which means the problem still exists. It's just in a different place. Have you heard anyone in the news mention that to the public?
Not at all.
Do you think they should mention that to the public?
Oh, absolutely.
Because I think that's not an answer. In my understanding, if you're shuffling people, it's not an answer.
Yeah. Again, it's just skewing the narrative, not reporting on the full situation, not reporting both sides.
Yeah. And that's how I understand it as well. And I think it's dishonest. I think it's disingenuous, and I think it's insulting to the public when you say, we have a solution, we've had a plan, and your plan is you're just going to shift where the problem is on any given day. And the way that I think, if I have to, looking at the way that New York State is run, wherever they're going to see the biggest number of protests, the biggest news media presence, that's where Kathy's going to shuffle all the people to.
Yeah, 500 people in Rochester today is my understanding.
Yeah, and they're just going to shuffle them in and Rochester needs 500 people. Let's take them from the Bronx. Let's take them from Endicott. Let's take them from Binghamton. Let's take them from Utica, New York, and we're going to shove them all into Rochester. Rochester's full. See, there's no problem there. The news media report, Rochester's fantastic. And 5 days later, they're going to take all those people and shift them over to, Dutchess County.
Yep.
And that means no one's been helped. The problem is still there.
Right.
I mean, my logic makes sense, right?
Yeah. It's all a dog and pony show.
Now, let me ask you this, Jordan, while I have you. One other question that I want to ask. Do you agree or disagree that there should be no exemptions, that no one has the freedom to make a choice, as has been stated by Joe Biden, Arnold Schwarzenegger, George Takei, and now Governor Kathy Hochul. Do you think that is correct?
No, you should absolutely have a choice. It's your personal life. It's your personal health. It's your personal decision.
I agree with that, but
I'm very libertarian on that.
No, it's perfectly fine. I'm just trying to understand, and I want to hear what people have to say about this, because no one else in the news media is asking. No one's talking to the public. I can tell you that I've been at four different protest events in Broome County with hundreds of people, and I've put that up, I've shown the video of it. Hundreds of people, I think half a dozen people have talked to me on the record, and 3 times as many doctors and nurses and healthcare professionals off the record, off the camera, have talked to me about this. And I can tell you that this is a serious issue.
Yep.
And it's not going to be resolved tomorrow.
Yeah, taking away people's freedom of choice when it comes to healthcare. I know one of my personal reasons for not wanting to get vaccinated is because of the liability waiver with the drug makers.
Oh, I wouldn't have even asked.
Pfizer, how many lawsuits do they have against them? They're just recently pulled Chantix off of the shelves because it has cancer-causing drugs.
Yes.
And they're taking liability away from the drug makers. It doesn't breed confidence.
They had a couple dozen people that had received believed to have cancerous effects from taking Chantix, which is a drug for people who are trying to quit smoking. It's a nicotine cessation drug. It's been around for about 20 years, 25 actually, and now they pulled it. They just pulled it because they just saw the long-term effect. It causes cancer in dozens of people out of hundreds of thousands that have taken it, and that was enough for the drug to be pulled forever. Right. We've had this around for 9 months. No one knows what happens with it. No one knows what the long term is. That's the reality. That's true.
Yep.
Is there anything else you wanted to say, Jordan, while you have an audience, people are listening?
I had a question that I wanted your opinion on.
Sure.
It just come to me. So all of these healthcare providers losing their jobs, understanding that we're in a free market, what is stopping them from being able to treat people maybe out of their homes or set up clinics themselves?
Because New York
aren't state or federally funded, where the government can't control, I guess, you know what I mean?
Well, the reason why they can't do that, it would be illegal. It would be a medical malpractice according to the law.
That was my thing with it, because I'm full support of capitalism and the free market. So to me, it seems like it would be an opportunity for one to say, okay, let me lease a space and open a clinic and treat to the best of my ability.
That would be absolutely possible if someone had studied. This is the reason why, if you are a doctor in, not the United Kingdom, I'm just thinking Canada as an example. You're a doctor in Canada, and unless you went to a very specific medical school and had a very specific training, which the overwhelming 90% of doctors don't have, and nurses and healthcare professionals, in Canada, when you come into the United States, your medical license, your medical licenses and certifications, none of them count, and you have to start over from day one. And so this is not a free market. It is highly regulated. The insurance is insane. Medical malpractice is the number one reason, medical malpractice insurance is the number one leading cause of the cost of healthcare in the United States. Has been for decades. That's why Obamacare doesn't work. It doesn't address medical malpractice lawsuits. And that's because it's so highly regulated, and you have to have licenses. And that's why Kathy Hochul stopped saying on Saturday, she stopped saying, oh, I'm just going to get people from other countries. You can't. She can't give those visas. And even if she did, the second they touch U.S. soil, they have to get retrained.
Right. Yeah. At least she understands that, I guess.
Yeah, someone told her that. One of the lawyers that work there told her. And so that means the problem is not going to be answered by just going and say, hey, you're in England, come on over. You speak English, come into our country and you can be a doctor here. And by the way, England needs more doctors. France needs more doctors. The world needs more doctors because there's a global pandemic going on right now.
Right.
So again, every way you look at this, what she has told you, or what New York State government is telling us, the people, makes no sense. They have no plan. They are literally making the problem worse and telling us that they have a plan that doesn't exist, because at every level, when you look at it, it doesn't work. And that means, and that's what's upsetting me.
Yep. Okay.
But I want to thank you, Jordan, for taking the time to speak with us, and I'm going to keep going with the conversation. Go ahead.
I'd like to extend to you. A friend of mine and I are actually starting a podcast. He got all of his equipment in today. It's going to be called "You Can't Handle the Truth," and we'd love to have you on at some point.
Absolutely. Send me a message, and we'll work out a time, and I'll be happy to go on.
All right, we'll do.
All right.
All right. Thanks, Mike.
You're welcome. All right, folks. So just like we had just received a call from Jordan, you too can call in at 607-242-1582. You can call from anywhere in the world. This is an international broadcast that I'm doing, a live stream. And I'm looking for your comments and your thoughts. Whether you agree or disagree, it's perfectly fine. You can tell me you think I'm wrong. I want to hear why. In fact, all of our healthcare workers and all of the people who may need a healthcare worker would love to hear for those people like Kathy Hochul, like Jason Garnar, that are telling us, County Executive Jason Garnar, that are telling us they have a plan and that we have no problem. Please tell me, call in and tell me why. Because I see nothing but problems and no solutions coming from our government. I only see them making it worse. And they're doing it all at the same time while disrespecting the Constitution, disrespecting the Fourth Amendment, disrespecting the Hippocratic Oath and the American citizens that they are sworn to protect. This is not how you protect the public, not in my opinion. You may disagree, and I'd like to hear why if you do. Or you can tell me why you agree with what I'm speaking about. It's up to you, folks, because unlike the rest of the news media, I want to hear your voice, because they have made you silent. They have told you you can't speak. They have told you that you need to shut up. I don't agree with that. That's not the way that America is supposed to work. We need to have it. We need to have this conversation. Watching Trains Go By mentions that I'm willing to bet most of the mainstream media and others haven't thought about it the way that the shuffling of doctors and nurses. It's a good point. But mainstream media won't explain it to anyone if they do figure it out. I am sure I am not the smartest man on the planet. Absolutely. I'm not the smartest man in Broome County. Absolutely. I may not even be the smartest man in my own house. Well, actually, in my own house, I have to be. I'm the only one here, besides my puppy Con. So the point there, though, is I know news media have figured this out. They know this. The politicians know this. I'm sure Jason Garnar, County Executive Jason Garnar of Broome County, has figured out that they're going to be shuffling people left and right, and that it's not going to solve the problem and may make the problem worse. I know he's realizing that we're looking at shutting down an entire hospital, that we are shutting down psychiatric wings, that there are overdose deaths that are going to occur because of this. He knows this, and yet he's still coming out with the answer, no, don't worry, it's going to be okay. It's only 15 people, and avoiding saying, well, that's 40% of the staff. See, they know. They're just not going to tell you. And that doesn't make the problem better. You can't fix something if you don't know what's going on. If you're in a boat and there's a leak, and you happen to be, and the leak is inside the boat, say you're in the... what is it? The Pirates of the Caribbean. Imagine the black ship. I forget what it's called. Black Pearl. You're in the Black Pearl. You're on the top with the steering thing, and you're steering away, and no one tells you that there's a big gaping cannonball hole in the bottom of the boat, and the boat is filling up with water, and you're sinking. The fact that they're not telling you this The fact that they're not telling you that the boat is slowly sinking isn't going to make the boat keep floating. It's not going to get you to your destination. You may not notice it right away, but everyone else knows the boat is going to sink. And just pretending that it's not filling up with water isn't going to help you. Well, that's what they're doing here in New York State. That's the equivalent, I would say, here right now. We are sinking. This ship is falling apart, and we have a bunch of politicians who are telling us, "Oh, don't worry about that. Don't worry. Don't even look at the problem. It's not a big deal." Are you kidding me? We've got a solution. What's the solution? I don't want to tell you what it is. Don't worry. It's good enough that I told you we have a solution. That is what Kathy Hochul has said. That is what a lot of the county executives across New York State are saying right now to the public. Don't worry, we have a plan. Don't ask what the plan is. Don't ask about the details of the plan. Don't ask us how we're going to make this happen or when we're going to make this happen. Don't worry. You just keep living your life. By the way, don't go to your local hospital if you get hurt. What? Don't expect to get treatment if you have cancer. Don't worry about, you're probably not going to get treatment if you have diabetes. Don't worry, you're not going to get that surgery that you need. That's all going to be put off. And hopefully you'll survive long enough until we get an answer so that you can survive. This is the problem they have put us in. Now, you can tell me, again, you can say, Mike, but they should just get the vaccine. And I know, I've heard from many people who have said, Mike, they just need to get the vaccine. That's the answer. Get the vaccine. They have no choice. Get the vaccine. And what about that cancer patient who, if they take the vaccine, they will die because of the complication? What about the people who are on medications that conflict with the vaccine and they will die? What about the people who have religious beliefs that tell them if they get the vaccine because of what's in the vaccine that they would go to hell forever? And they're worried about their souls. Are you telling me that that doesn't matter at all? That these people should give up their rights? Then let me ask you, when the government comes to you and the government says, you can't eat that, you can't drive to that place, you can't drive. When the government starts saying that they're going to control every aspect of your life because they're smarter and they're there to protect you from yourself, and that means you don't get to make any choices, do you really want to live in that country? Because that country isn't America. That isn't America. And I love these people, but everyone's going to die. No, they're not. We didn't have a vaccine 18 months ago. Everyone did not die. So you can't tell me, well, everyone's going to die. No, they're not. They didn't die. We just got the vaccine back in January. In January. This has been 9 months. We went through 18 months without the vaccine. And everyone didn't die. So you can't tell me, well, everyone's going to die tomorrow. No, you're not. On top of the question, well, you got the vaccine. Fantastic. Isn't that supposed to be your shield? Which means you shouldn't have to worry about me? I know that's completely disputed by things like Chris Rock, who's vaccinated. He's vaccinated, and yet he still gets COVID. We have how many breakthrough cases on the View with Joy Behar? 2 of their people who were vaccinated got it as well. So, but none of them are dying, of course. So you can't tell me that this is the cure-all, the be-all and cure-all to everything. The world isn't going to end if more people don't get vaccinated. And at the same time, if you are vaccinated, that's no guarantee that you're going to be better. Now, I will say again, this is a conversation. If you want to talk about whether you should or should not get vaccinated, that's a conversation for you and your doctor to have that conversation based on your medical health care, about your personal medical history, and you need to make that decision yourself. I'm not telling you to do it or not do it. I am pointing out facts that we see that are all around us, and I'm just saying, think about it, because it's not all or the other. We didn't all die without the vaccine. We're not going to all die without the vaccine. But you can have the vaccine, and don't think that that's a cure-all to everything, because it isn't. That's a reality. So with that question put to the side, let's deal with the situation right now, which is we know for a fact, as a consequence of what Kathy Hochul has done, we're going to see people in our community die from things like diabetes, overdoses, car accidents, medical histories, cancer, because there aren't enough healthcare providers to be there. We're going to see people die in nursing homes because they're not getting the treatment they're supposed to get. Because we don't have the people, because Kathy Hochul just fired them all. Because Lords and UHS, Bannett, and Willow Point fired them all. Hang on. Thank you for calling in. This is No Soundbites Allowed. My name is Michael. And may I ask who's calling? Your first name.
Hello, my name is Brandon.
And Brandon, do you live in Broome County by chance?
No.
That's fine.
I live in Dutchess County.
Okay. And go ahead. Thank you for calling into the program. Go ahead.
Yeah, it goes without saying, but what's been going on has been madness.
Yes.
These past 2 years. But I think we should. No, Hochul is no good. Just no good.
Mm-hmm.
We have to look to the future also. With in 2022,
mm-hmm.
gotta find a way to beat her.
Well, I'm not even thinking about the election yet. And I don't want this to, I'm not even talking, if you notice, I haven't mentioned anything about, I'm not speaking about Democrats and Republicans. I'm not talking about libertarians and conservatives or progressives. I'm trying to just understand this in the terms of, freedom, healthcare, and consequences, which I think is a conversation everyone can have no matter what your beliefs are. I think Hochul, do I think that her doing this and hurting the people in New York State deserves to get her out of office, that she should be kicked out? Yes. Is that the thing I'm going to focus on right this second? No. But I guarantee you later I'm going to bring it back up.
Of course. But I think it's always good to, always good to talk about it.
No, it's worth mentioning. It's something for people to put down in their little phones as a reminder, in 6 months. Hey, remember that Kathy Hochul just killed a bunch of cancer patients. She just killed a bunch of people in nursing homes, just like Cuomo did. I want to remember that when she's asking for money. Let me ask you this. Did it make sense to you? I don't know how long you may have been listening, and I thank you for listening from Dutchess County. But does it make sense to you that the answer Kathy Hochul is making, which is about the National Guard, that they're just going to be shuffling a bunch of doctors, nurses, healthcare workers throughout the state, wherever there's a bunch of news cameras saying, hey, we have a problem, and she's just going to shuffle people in and out of the places that have the biggest news media to make it seem like she's got an answer, but it's not really going to fix anything? Did that make sense to you?
Of course not, especially when you mentioned earlier about how there's just not enough people, and the different doctors have different patients.
Well, let me ask you this.
How to organize that.
Yeah, let me ask you this. Did it make sense? Did you know that New York State, the United States, has right now 1.8 million openings in the healthcare industry? That's doctors, nurses, healthcare workers. And did you realize that approximately 10 or more, maybe 11, 15% of healthcare workers in New York State just got fired today? Did you know that?
I didn't know that before the show. No.
Okay. Do you think that's going to have an impact?
Of course, yeah.
Okay. And let me ask you, Why is there anyone in Dutchess County in the news, the major mainstream news? Is there anyone having this conversation at any level?
I've only heard relatives talk about it. I haven't. Besides that, none.
That scares me. It scares me that they don't even want to have this conversation, because it would be one thing to say, and I keep asking, and I've been asking since the people have been doing the vaccine mandate protests. I've been asking for the other side, for the side that's saying we have to do this, that we don't have any freedom. I would keep asking them to say, okay, well, explain it to me. Why? And they won't. And that makes me trust them even less. How about you?
Yeah, definitely.
Okay. What else were you thinking of? Was there something else you wanted to speak about, or any part of this that you wanted to address?
Well, I mean, it's somewhat related, but
sure.
The college is also.
Yeah.
College is how they make it. They're making the vaccines mandatory there.
Yeah. And Broome County. Oh no, not Broome County.
Well, I personally go to Dutchess Community College, and the only way I'm able to get in without getting a vaccination is through a religious exemption. I'm not sure how long I'm going to be able to keep that up. But
that's a good question. Well, it's interesting that they're willing to give exemptions for religion at state colleges, like Dutchess Community College. They're willing to give union workers at the Civil Service Employees Association. They gave them an exemption, as reported by Spectrum News on September 24th. And that's something I have on the screen right now. That New York court, the actual title of the article is from the State of Politics. New York court workers win temporary block to COVID vaccine mandate. So they're willing to give a union an exemption. They're willing to give students with religious beliefs at some of the state universities an exemption, but our doctors, nurses, and healthcare workers get no exemptions, no way out. They just get fired, and they get denied unemployment. That doesn't make sense to me.
It doesn't.
And no, have you heard anyone mention that before, that this is happening? Again, this is what's been reported in the news.
No. Again, besides relatives, but
right.
Besides that, no. It's gonna hit people out of nowhere, and then a lot of people aren't gonna see this coming. When they hear that their doctor is no more, they're gonna be shocked.
Let me ask you something. You sound like a younger person. By your voice. I don't know. It's okay. You don't have to mention. But you sound like a younger person. So I know a lot of younger people have been getting the vaccine because they feel the peer pressure and they feel like they have to. One, am I correct that there's a lot of peer pressure for people who are younger? And two, do you think younger people that they want to see the exemptions, or do they want to all force everyone to lose their freedom?
Now, this is my personal experience.
Yeah, just your personal opinion.
But I haven't seen students pressure people. I've seen, the college itself is handing up posters everywhere, like, oh, get vaccinated. The college itself is pressuring people. I haven't seen too many. All in all, I've actually seen students mind their own business.
Yeah, that's what I think a lot of people generally are doing. And a lot of the news media and the politicians, they're selectively telling people about what's going on. They're selectively letting you know some of these deals, but they're not putting it in front of you. They're like, okay, we published it on page 26 out of 30 in the newspaper at the bottom in the lower left-hand corner. So we published it, but we're not going to tell you that we published it. It's just, you got to search for it. At least that's the experience I've been seeing. Have you been seeing the same?
I mean, Can you elaborate once more?
Sure. Would you say that my experience is that most of the information I'm talking about today, I had to search and search for it because it's not something that was right up front. It wasn't like front page news. They shoved it in the back of the newspaper. So they made it hard for me to find out. But their answer, if you ask them about it, they say, well, no, we published it. It's like, yeah, but you published it in the back of nowhere. It's almost impossible to find unless you know exactly what to look for.
Yeah, you do have to scrounge around a lot for this type of stuff.
Does that make you feel more confident?
Does it make me confident, you say?
Yeah, in what they're saying. And, when they tell you, well, yeah, everything's perfectly fine. We've got plans. We've got the answer. Do you feel more confident that they're hiding all this other information from you?
Yeah, hell no. I mean, they've been saying they've got plans for the last 2 years, and they all go awry.
Okay. Was there anything else that you wanted to mention while we have you
on? No.
Okay. Well,
nice talking to you.
No, I appreciate, and thank you for giving us another opinion, another way to look at this. It's very important.
See ya.
You too. Bye-bye. And folks, you too can make a call at 607-242-1582. You can tell us your opinion. And again, you can say you don't agree. You can say, Mike, you just don't understand. Fantastic. Please explain. Or maybe you'll say, Mike, you didn't see this in the news. Here's the answer to the questions you have. I'm happy to see that. Tell me. Let's have that conversation. I would love for County Executive Jason Garnar, someone who I personally know, who I have spoken to individually as a person in the community outside of the news media. He will not come on this show again. He's been on this show. He has been interviewed by me. We have published the interviews before. He knows that I will give him a fair shake. I would love for him to call into this program. I know he watches the program from time to time. I know his staff watch this show from time to time. I know that they know about this. I would love for him to call in and say, well, you just don't understand. Let me explain. Let me tell you how it's going to be so much better for the public. But they won't. And it's because I'm going to ask him a very direct question. Where are they getting the doctors and nurses and healthcare workers from? Because they don't exist in America at this moment. We are short 2 million doctors, and New York State just became short 2 million healthcare workers, and New York State just added to that number by 45,000. By the way, we also added to the burden in our community because since everyone who's gotten fired, according to Kathy Hochul, they will not get unemployment services. They're not going to get any government aid, which means we have individuals who have just been made bankrupt. They can't pay their mortgages. They can't pay their rent. They can't pay their food. They can't feed their kids. They can't drive. And they're supposed to stay in New York State. Why would you stay in New York State? And I can tell you, a lot of these doctors are leaving forever. I've had conversations with doctors, nurses, and healthcare workers for the last 4 weeks. And I don't know, I'd say about 50% of the people I've talked to said they're going to leave this state forever. I had a gentleman who made a comment, Michael, yesterday on my live stream on Sunday. And his answer was, I have gotten, in the last 2 weeks, I have gotten more job offers than I have ever gotten in my entire life, and they're all out of New York State. All of them. We are losing population, and we're going to leave. This is a massive exodus. Imagine, we were already short-staffed. We just added to that staffing nightmare. We have hospitals that are shutting down. We have surgeries that are being stopped. We have people who aren't going to be treated. And we have our doctors, nurses, and healthcare workers. They're leaving forever to go everywhere else in the country except New York State. This problem just got exponentially worse because this is a long-term problem. They are moving out as we speak. As we speak, there are people in U-Hauls right now driving out of New York saying goodbye forever. And that means New York State loses that tax revenue. We lose the buying power. Our businesses lose those customers. And our community loses that healthcare worker forever. And there is no one there to replace them. The people don't exist. We don't have a surplus of healthcare workers. We have a deficit. We are short. And these people are leaving forever, meaning our problem just got worse. It didn't get easier. And Hochul is telling you, don't worry, I'm going to shuffle a bunch of people all around the state so you won't notice that the problem isn't being solved. That seems vicious to me. That seems almost evil. Because when you think about it, and I know the news media says, the mainstream media tells you, don't think, don't speak, don't think. But when you think about it, you have to, it turns around and goes, that sounds really evil to me. Maybe you think I'm wrong. Maybe you think, Mike, you're just a Republican, so everything's evil. I'm not talking about politics. I'm not bringing up Democrats or Republicans or libertarians or conservatives or progressives. You haven't heard, I'm not talking about that. I'm talking about people. I'm talking about my community. And I'm desperately waiting to hear from members of elected officials. The only elected official that has said anything, Claudia Tenney, Congresswoman of the New York 22nd District. She sent her representative down on Friday and made a speech and said that she's working on this issue, that she's trying to protect people's freedom and their exemptions because that's what America's about. She's the only one. I've asked the New York 19, Antonio Delgado. I asked him for a comment for the last month. He won't talk about it. He won't speak about it. He doesn't care. I've reached out to Jason Garnar. He won't speak about it. I've reached out to several of our politicians, and they just won't comment. So let me get back to some of these comments. And I apologize. I know I've been speaking a lot and not responding. Lee mentions, and Lee, great to see that you've been watching the program. Lee says, how long before they strip their credentials, the credentials of the doctors and nurses, and prevent them from ever being able to practice medicine or healthcare in the United States? That's terrifying. So that's punishing them for not doing what they're being told. That's expressly anti-American. And if they were to do that, and I don't know that they won't, because it's a threat. Just like the same threat, you can't get unemployment. Well, that means that they have to leave New York. That didn't make the problem easier. It actually made it worse. Do you see why I'm saying, folks, they're making the problem worse every step of the way? They're taking the worst decision that they could. They didn't, not only are they saying the doctors and nurses and healthcare workers can't work, they're saying, oh, and you get zero money, which means you're forced to go to another state. So at the very least that you can get some money to pay for your bills, if not just because you want to do what you do for a living. It's terrifying. Jason mentions it's a strike and they're hoping the workers cave. This is a must win for the workers. I agree. Tina mentions, and since last summer, there's actually numerous treatment protocols. Just many doctors won't use them. That's true. Jason mentions people can't be coddled into unconstitutional policies. Well, that's why a lot of people are fighting this, I think. Kevin mentions that, hey, Kevin, it's good to see you. And by the way, hello, Jason. Almost none of this has made sense since the beginning of the whole pandemic. The only thing being talked about is the political aspect of it, when this isn't really even political, but the media is making it such to further polarize and divide the nation. And I generally agree with that, except, as I said, I'm not talking about politics here, but there is a political component based on who's saying you don't have any rights or freedoms. those are almost entirely coming from people of a specific kind of political ideology. And that's where you're seeing that division. And that's a shame, because it also doesn't answer the problem. Even if I believed in the ideology, the political ideology that says you don't have the freedom to choose your life, that still doesn't fix this problem, as I've gone through with several of the examples. Kevin mentions any question or information that doesn't align with the narrative gets either squashed or, as you said, buried. Exactly. They've been burying this. This should be a conversation that you're hearing on MSNBC, CNN, ABC, Spectrum News, WBNG, WMBF. You should be hearing this in Press Connects and the Observer Dispatch. Your local news should be having these questions. The reporters should be asking our elected officials the questions I have presented, and they should be getting answers. If there is an answer, if the answer that Kathy Hochul is making, which she has told us, is to shuffle people throughout the state so it looks like someone's getting help even though they're not, and just shifting where the problem is at any given moment, then let me ask you, if that's not the case, why won't Kathy Hochul say that? Why won't the news media ask the question and have her answer it? Why won't Jason Garnar? He's the county executive. Why won't he answer it? And maybe, I'm not picking on him. I would love to hear from Assemblywoman Donna Lopardo to tell me the answer to that question. I'm not picking on her. She's my Assemblywoman. I'm going to point it out to her. I would ask any of the members of the New York State Assembly this same question, or members of the New York State Senate. Answer this question for me. Tell me, allay my fears. Resolve my concerns. Tell me how you are fixing this, and don't tell me that you're just shuffling a bunch of people around the state so that every time the news media turns on a camera, they see a bunch of people there, and when they turn the camera away, those people are gone too, and the problem's back to normal. Teresa, thank you for joining us, Teresa, and she's on YouTube. So again, folks, you can reach us on YouTube, Facebook, Twitter, DLive. You can reach us from anywhere. And if you haven't subscribed, please do. This is the kind of stuff that we try and do all the time on this show. Teresa mentions, can you talk more about the numbers of healthcare facilities and services that are being cut? Also, have you heard that healthcare is going to be limited or denied in some states to patients that are unvaccinated? So what I can say is that the numbers look like, and I was trying to do some quick math. In Broome County, it looks like there are about 1,000 people that we have lost in our community. 1,000 people who got fired and are not being, they don't have any access to unemployment. They're not going to have any cash or services from the New York State government. And we're going to lose a bunch of those people to go into other states. That's 1,000 people. That's including doctors, nurses, cafeteria personnel, janitors, you name it. Everyone who works in the healthcare field, people working in nursing homes, healthcare providers, nursing assistants, all of that are in that 1,000 people. That's 1,000 people in a day. That's 1,000 people who are no longer paying rent, who are no longer buying stuff at the local store. They're not going out to restaurants or bars. That's 1,000 people who can't pay their rent or they can't pay their mortgage, which is already a problem in New York State. And it just got worse. And that's people who are going to default on their loans. It's going to affect banks. Do you see the economic snafu here? It spirals. This is never just one thing. It spirals, though the consequences of what was done is enormous. And you can't tell me, and no one can say, well, you know what? The only choice they have is that they have to comply. They have to do what the government says. They have no choices in their life. Well, that's not true. That's not accurate. And we know that because, as reported by Spectrum News, we know on September 24th that people in the Civil Service Employees Association, the SCSEA union, were given an exemption 100 of their workers that work in the New York court system. If they can get an exemption, then that means everyone is not required. It's not 100% compliance. If anyone is able to get an exemption, then why are we beating up on healthcare workers? Why are we beating up on our nurses and our doctors? And by the way, New York Education Union is against the mandates for teachers. Teachers may be getting an exemption. Why are we willing to give certain unions and certain industries an exemption and making everyone else not get an exemption? Maybe that's political and it's partisan, or maybe there's favoritism, or maybe it's just because our government is completely inept and they have no idea what they're doing. And they are praying that someone like I don't get on the national news media and say, hang on, you haven't answered anything. You've made the problem way worse on so many levels. It's going to affect more people, and you're devastating us. You're destroying our nation. You're destroying our state. And I've yet to hear the argument to say, well, no, Mike, you're wrong. I have yet to hear the argument, and I've yet to see the evidence that says, well, that's not correct. And you can't tell the public and say, well, no, but everyone, it has to be 100% compliance. Then why are we giving certain unions an escape clause that they don't have to comply? We're telling certain unions they don't have to comply. It's on Spectrum News. I've got the article. You were probably not told about the article. You didn't know where to search for the article. They're counting on the fact that you're not going to bring up this issue. And they want you to think, well, everyone's going to do it. Everyone is just blatantly following Kathy Hochul because she's Jesus on earth reborn, which is not true. So that's the problem. And yes, Teresa, landlords are taking a beating. We have 12 to 14 million Americans that are facing evictions as we speak. 12 to 14 million. How many more are going to be added in our community because Kathy Hochul is saying, I'm willing to give this union, CSEA, I'm going to give them an exemption. They don't have to get the jab. But guess what? The doctors do. The healthcare workers do. And I'm willing to bankrupt them, to leave them without the ability to pay their rent, to pay their food, to take care of their kids and their families. I'm going to force them out of this state. And that's going to be worse for our economy. Again, this is going to take away from our taxes. This is taking away from our small businesses. This is going to hurt our health care, not only the quality, but the quantity of it. And it's not because everyone has to do what Kathy Hochul says. Everyone has to get the jab. No, they don't, because they're already not. 100% of the population is not required to do this. So that means exemptions exist. Then why are we telling one group of people they can't get that exemption, and we're telling another group of people, yes, you get to have it? Does that make sense to anyone? Because this is the news. This is the news. I've shown you the link at the end of this show. I will include the link in the description so that you can ask this question. You can read the articles yourself. These are articles that are coming from NBC, ABC. They're coming from Spectrum News, the Associated Press. This is coming from the, what is that? That's the Sentinel, the Rome Sentinel. I've got it from Fox 40, and I mean, all of the major news media. This is coming from them. I spoke to the police chief of Binghamton. These are original, absolutely credible sources. This isn't some kind of conspiracy theory. This isn't just me making this up. These are quotes from Kathy Hochul herself. These are quotes from Joe Biden himself. These are the facts that are happening to us, and it doesn't add up. There's a bigger problem that is being created with no solution whatsoever. And all I'm asking is, if there is a solution, why won't our government tell us? And if there isn't a solution, then government needs to get on this and do their job and get it right. And part of that is respecting American citizens and their freedoms and the amendments in the Constitution. That's part of the answer. I guarantee you that's part of the answer. Because if you're giving exemptions to some people, and we know that 95, 98% of people are going to survive no matter what, then you can't tell me I don't have freedom of choice. You can't tell me I don't have privacy of my own body. What's that one saying that one of the political groups likes to say? My body, my choice. I don't get that option. Why? Because I'm a male? Because I'm black? Because I'm Hispanic? Because I'm a Republican? I mean, what's the basis that we're making these choices on? And I'm not saying that these are the reasons we're making these choices. That's why we've heard Kathy Hochul, why we've heard from Joe Biden, why we are hearing our elected officials say these things, tell us that we don't have any rights or freedoms. I'm not saying it's because they're making it on the basis of race or religion or political preferences or gender. I'm not saying that that's the reason. I'm asking because I don't know what their reasoning is, because it's like Swiss cheese. They tell me you're telling us stuff, and there's holes all over it. There's more holes in what's being said to us about this situation, and the fact that they just fired 40,000 people in the healthcare industry that we desperately need. We desperately need these people. They were already working overtime, that they were already overworked and understaffed, and we just made that situation so much worse. And I'm listening to them tell us this story, and it's worse than watching The Last Jedi. There's more holes in this than Skywalker Rises. This is literally like Swiss cheese. And every time I speak to a politician who, and it almost always has to be, in this subject, it has to be off the record. They won't speak on the record. And every time I ask them about this, they go, I don't have an answer for you. It doesn't make any sense. And now we have places like Lord's that is turning around and trying to use the police to intimidate the public. As I said, when I spoke to Chief Zukuski this evening, and I spoke to him and he knew we were speaking on the record, he knew that I was going to quote him. And we spoke about it and made sure I was very specific about my question. I was very specific about the answer he gave us so that I could give this to you, because I know no one else in the news media is asking him this and no one else is reporting this, that we have Lords is going around, and I believe that they're doing this not just in Binghamton, but they're doing this in Owego, and they're doing this in some of their other satellite offices. So there's several counties, Tioga County, Broome County, I believe Delaware County, possibly a few others, where they are going and they are trying to get police to intimidate the public because they just fired a bunch of people to cover up for the fact that they don't have a plan. And they want to deny these same people the ability to have health care so that if someone they're diabetic and they work in the hospital and they need to get dialysis, the hospital is trying to use the police to stop the public from going in. And thankfully, every single police department that I am aware of has turned around and told Lords and the other hospitals like UHS as well, and told them, no, we don't do that job. That's not our job. That's not the law. That's not how that works. They will not do that. And I think they need to be commended for that. And I know the rest of the news media is not telling you this. I can't wait until tomorrow when someone goes to UHS or they go to Lord's or they go to one of the other hospitals in the region, maybe Bassett Healthcare, maybe they're going to be going over to Syracuse University, and they're going to walk in and they're going to say, or Binghamton General Hospital, they're going to walk in and say, oh, I need medical help. And the hospital is going to turn around and say, you used to work here. It doesn't matter. You can't be served here. That we're not going to take care of your medical issues because you used to be an employee. And they're going to say, oh, we want to get the police to arrest you. Can you imagine that? My God, if there's even one person on dialysis that's going to be turned away because they used to work at that hospital and that person dies, God forbid. Oh, can you imagine now lawsuits for that? And they're well deserved if that happens. But they're trying to use the police to do this. And I think that's such an abuse of the police. And it's an abuse of your tax dollars. It's an abuse of your government when this private institution is saying, no, the police are going to be our security guards. They're going to shoo people away from our doors. What is this, Australia? Are we in Australia? Police are just going to roam down the street. Oh my God, you don't have a mask. We're going to beat you down now. Have you seen the videos? That's what's happening in Australia. That's what's happening in New Zealand. That's where this stuff leads to, folks. That they're just going to randomly beat upon you because you're not complying. Because you're not doing what you're supposed to do. Unless you happen to be in one of their protected groups. You happen to be one of their special people. That you happen to have special friends that are able to pull strings for you. Just like the Civil Service Employees Association. Mind you, I'm not picking on the people who work there. I'm not picking on the workers. I'm talking about the union and their political, their political power and their ability to make the government do what they want. Because I guarantee you that the CSEA, and I know for a fact that definitely they make a lot of donations to certain political parties, and they have a huge amount of sway in New York State because of those donations they make. And I have to believe, and I have no reason not to believe, that their political donations are the reason why all of their employees get an exemption and they don't have to get the jab. But meanwhile, our doctors and nurses do. And if you think I'm wrong, I'm perfectly happy to hear your argument why. But based on the news and based on the vacuum of information that's coming from our elected officials, I have no other I have no other way to conclude something else. And it's not about what I want. I know people will sometimes say, and I do see your comment, Teresa, I'm going to address that in 1 second. It's not my personal truth. This isn't my truth I'm talking about. I hate that statement. There is one truth. And then there's our subjective opinions. You can tell me that you think my conclusions are wrong. The sources are facts. These are correct. You may disagree with the conclusion. You may want to tell me that when New York State loses 40,000 people, 40,000 employees, when Broome County loses 1,000 workers in high-paying jobs, and those people have no income, you can tell me, well, Mike, they're going to be perfectly fine. They're going to live off their savings forever and they'll never have to worry about it. That they have money flowing out of their pockets and there's no problem for those people whatsoever. You can tell me that. I wouldn't agree with you, but you can tell me that's the answer. You can tell me that these people, well, they'll just go to another state and we'll get 1,000 new doctors and nurses and healthcare workers that'll rush right into New York State from every other state in the nation, even though every state is short employees. 1.8 million healthcare workers don't have a job. They don't exist. The jobs aren't there. The jobs are there. The people aren't there. We don't have enough people. And you can't snap your finger and say, hey, this kid, he's in high school. He's a doctor now. Hey, look at that. You're in what? Community college? Fantastic. You're a healthcare worker now. You can't do that. This isn't on-the-job training. Hey, you know what? You used to be a mechanic. Come on over. Come to the hospital and we'll do on-the-job training and you're now going to be a nurse. You're going to work in the cardiology department, or maybe you're going to work in oncology, dealing with cancer. It doesn't work that way. This is a problem that if Kathy Hochul, our governor, our newly appointed governor that no one has voted for, I will say that, this woman who just took over, that she's suddenly, if she's absolutely on the ball, and New York State is working as efficiently as any state government can, which is not true, will still take us weeks to get this right. Thank you for calling to the program. This is No Soundbites Allowed. I'm your host, Michael Voss. May I ask, what's your first name?
It's Lee, Michael.
Hey, Lee. And Lee, I know you're not in Broome County, so you're in another area. Go ahead.
No, I'm in Bradford County in Pennsylvania.
Yep.
But I had an interesting thought by what you're talking to the chief of police.
Okay.
Now, the governor says she's going to use the National Guard to replace these workers.
Yes.
Now, you and I both served in the military.
Yes.
You know, you were a radio man. I was a combat engineer. Mm-hmm. What the hell good are they going to do in an emergency room? Now, secondly, another conundrum. New York has 16,000 National Guard total. Mm-hmm. So if we're lucky, say 1,000 of them are qualified medical personnel.
Which would be an incredible percentage. Yes.
Yeah, I mean, that would be an incredible percentage. Now, what about when you hit a conundrum, like you said about Lords?
Yeah.
One of those nurses that they fired is in the National Guard and refused to get vaccinated.
You know, that's a good point that I hadn't brought up before. But yeah, what about some number of these doctors, nurses, healthcare workers are already in? They're the very people that she's
going to be called upon.
Yeah, she's going to be calling on the very same people she just fired. What's she going to do then?
But, you know, what's the hospital going to say? That, oh no, you can't come in here and work here because you're not vaccinated. Well, just because she's international, I won't say she, I'll say just because they're in their National Guard uniform, mm-hmm. they're still not vaccinated. Right. So how can they work in the healthcare industry?
Which is a really, you know what, you're bringing up a great point, and I missed it somehow. And that's one of the things people should realize. I've thought about this a lot. I think it shows, and I've researched it a lot, and I missed that point you're making right now, and it's perfectly logical, and I missed it. And God knows, then what are our elected officials missing because they won't talk to anyone? They won't talk. The news won't talk to anyone. So how much else have we missed? It's a great point.
Okay. Another interesting question this is going to kind of divert from the healthcare.
Okay.
We're soon going to lose police and military.
Yes.
For the same very reason.
I believe
lots of industries.
Well, I think police, or at least certain police departments, have gotten an exemption, which again means if they're getting, and I believe they got an exemption, and if they are, then why are we so upset about healthcare workers? If they aren't, then yeah, we're losing a lot of them too. So that's going to be another big problem. You're right. Go on.
Those people will have to be replaced at some point. In some way. What's the Democrats' method of replacing people fast and doing things? Is they're going to cut standards? Is a perfect example the governor of Oregon.
Yeah.
With the high school diplomas. But when they cut the standards for enlistment for police, because all these people with strong beliefs that are probably the ones that we most need on the job, regardless of what the majority of the Branch Covidian cult thinks.
Yes.
That they're proud because, it's, if you're not vaccinated, you're obviously a Trumper and deserve to burn in hell because you're not just going to follow the science or follow their science. But who are they going to replace them with?
I don't know.
They're going to do just like Australia has done.
Yeah, and for people who don't know, in Australia, the military is now walking around as if they were police officers. They're the actual military, and they are literally grabbing people in the middle of the street as they're walking down the street and just grabbing them, beating them up, and throwing them into isolation because of the mandates. Just for walking down the street. And, go on.
This is where I think part of their plan is really at, Michael, because as you know, my wife is Australian.
Mm-hmm.
I've been there a couple times, spent several months there. Do you know the one thing Australia has that we don't? That has been one of the biggest backstops against all these mandates?
No. What?
They don't have local law enforcement. They have state and federal police. There is no Melbourne Police Department.
They're all government agents, not city or county.
The Victoria State Police. Now, think about that here for the U.S., Michael. You create all these new positions in the state police, and with the way things are, you make sure that, of course, the woke are going to benefit the most, that you are basically recruiting the thugs and bully boys that are either the woke who believe all of this stuff and want to see problems that are way bigger than they are.
It's crazy. It's trouble. Go on.
When you have those guys replacing, say, the Binghamton police, okay, now the Binghamton police are New York State police. We'll say maybe 10% of them are from Binghamton. The rest are coming in from wherever in the state. They have no ties to the community. If the governor gives them an order, and with the lower caliber of recruits, what do you think's coming very soon?
we'll see another wave of the same kind of problem that we've seen in 2020 with all the cities that defunded the police, where we see skyrocketing a 30% increase in violent crime in the United States because we don't have enough people, we don't have people in the right positions, and politicians say, I have a plan, and we're seeing nothing but inept, absolute chaos. That's what I think would happen.
Because I think that these mandates are a way to push for socialization, for socialized medicine, and even getting rid of local law enforcement to create state or national police.
Yeah, that scares me.
And there's a huge power grab going on right now that people don't understand.
Yeah, and I want to mention, I brought up something. I'm going to show it on the screen. I don't know if you're able to see it right now because you brought it up. And I want the public to remember how we got here. Because you're talking about the police. In New York, on December 15th of 2020, according to the New York Post, the article headline is, "The pandemic vaccine will not be mandatory for New York Police Department." This is coming from Shea, and that's the Commissioner Dermot Shea of the New York Police Department, New York Police. So, and this is exactly what they said, that they are not going to mandate it. That was in December 15th of 2020. On September 10th of 2021, the headline from the Gothamist, which is on the screen right now, and again, I will include the links in the description after the show. De Blasio threatens to withhold New York Police Department wages if cops defy vaccine or test orders. So they're going to take away the people's pay if they don't get the jab. The very same people that they absolutely promised just 9 months ago told them, don't worry, you're going to be okay. It's not a mandate. And now they're saying, and if you don't do what we say, you're going to lose your job. And that means not just healthcare workers, police, teachers. Who's going to take care of these jobs? Who's going to take care of the public? How are they not destroying our state and our country by doing this? It's crazy. The consequences are, they don't talk about the consequences. They are huge.
As far as I'm concerned, they've thrown up the black flag. I hate to say that, but that's what we've come to.
Yeah. We really, really have. And it's getting worse.
Because, the only ones who are willing to compromise on their side, they're willing to threaten them and throw them to wolves in order to get their way. Nobody's willing to compromise on anything. And I mean, I understand that everybody's got their agendas and stuff, but how the hell did these lunatics take over on the far left and far right that nobody can reach an agreement anymore?
It's something crazy that our government, the best outcome, I've asked this a lot at the 4 different vaccine mandate protests that have occurred in my community alone, with hundreds of thousands, literally hundreds of people that have come together and spoken to me and asked, what's the best thing that could happen? The best thing that Kathy Hochul could have done is to speak to the news media and therefore speak to the public, or some of our elected officials like Representative Antonio Delgado or County Executive Jason Garnar or Assemblywoman Donna Lapardo, that they could actually reach out to the public and actually they would have heard the questions I'm making right now about how they're going to reshuffle people and not actually fix the problem. How we can try to fix the problem of losing in this local community, in this city alone, going to lose 1,000 people and all the taxes and all the businesses they're going to affect. They would hear this problem, and that would give them the chance to actually think about what they're doing and try and get a better answer. Because when they're not listening to anyone. And if they're not listening to anyone, they don't know, one, what the problems are, and the solution that's not coming to them. Because they're not hearing anything. All they're hearing is from the think tanks, from the TV shows, NBC, CNN. All they're saying is, good job, great job, you're doing fantastic. Oh, I'm so happy for you. I'm going to make sure I vote for you again. And no one's hearing that, but wait, there's a problem. You opened up the door to a bigger problem, and you're not answering it. And God help me, I know there's politicians who are watching this right now. I pray to God one of them actually takes the time to turn around and call in or to reach out to me. They have my phone number. They know me personally. Send me the email. Send me call me on the phone and say, Mike, here's the answer. Tell everyone. And I'll be happy to do it. But they won't, because they're not listening. And that's because they're playing politics, some of these people. And that's terrifying.
And, it really is, because everybody just... I don't know who's coming up with these policies or anything, but nobody's actually talking to people who do stuff.
That's true.
I'm sorry. When you've got Nancy Pelosi, Chuck Schumer, and them, they're all octogenarians, or damn close. Kamala Harris is the youngster of the administration. She's in her 60s.
Yeah.
And none of them have done real jobs, if they ever had one.
Well, most of them have never had a real job.
That all they have been is politicians, and that's our biggest problem. You've got people making laws that they're listening to all the experts that have, one of the few people in Congress, like Rand Paul is a medical doctor.
Yes.
There's a few others that I think are. There's some of the younger crowd that have had real jobs on both sides, that I know there's a bunch of veterans that are up and coming.
See, I wouldn't even mind that they were politicians all their lives, that they've never actually had a real job, that they've done nothing some of these people have been around as long as they've been in politics, about as long as I've been alive. I've been alive for half a century. Some of these people have done nothing but politics for half a century. And I wouldn't be upset if it wasn't for the fact that they're not having a conversation. I've talked to doctors. I've been talking to nurses and healthcare workers as they're telling me, well, I'm going to just leave. This breaks the reasons are for medical, for religious, because it breaks the Hippocratic Oath, because it denies people the choice to make their healthcare decisions for themselves. These are people who care a lot about you, me. They want you to be healthy. They want you to make the right choices. They don't want someone to shove something down your throat that may not be good for you, that may or may not be the right answer for you. And they care, and they put their lives, their jobs on the line, and these politicians are turning around and going, yeah, I don't care. I don't understand how we got to this point, because that should never be, well, their answer is, well, Mike, you're just a conservative Republican. What's that got to do with anything that I've been talking about? It shouldn't have anything to do with anything about this. It shouldn't, but it does.
Yeah. Because, I mean, I can agree with you even about the career politicians. If they actually took the time to listen to how things are done. Because so many of them have their ideas about things. And it's completely insane that they have no, when they go out to a building site for a groundbreaking or something, they think that's all there is to putting up a building or something. They don't understand everything else that goes into it. All the people, not just the builders, but the people doing the paperwork, the reports, the surveys, all that crap.
Yeah.
And I mean, they've just turned things. It's like they want the rest of the country to get nothing done just like they do.
Which isn't good for anyone. And that's a problem. We can't run this nation. We can't run this state like that, because everything falls apart. And it is falling apart, but this is going to make it so much worse. But by the way, hold on one second, Lee.
Okay.
I wanted to mention to everyone, and you see it on the screen, I forgot to put this up earlier. Please share this with other people if you're watching this now, that Broome County, there's going to be another protest. It will be on October 9th from 3 till 5 p.m. It's a Saturday, so people will be able to go. It won't be during work. So it'll be the first protest in Broome County that is actually going to be on a Saturday. It'll be October 9th from 3 to 5 p.m. It will be held in downtown Binghamton, so that should be very easy for people to reach. They're going to be down by the courthouse, and they're going to be protesting there. And if you want your voice to be heard, join with them. I will be there. I will be recording that. I will publish that for the public so that you are not alone. Not in this fight. You're not alone. So I did want to mention that. Lee, I've been going for about 2 hours here, so I'm going to be wrapping up in a few moments, but was there any final thought you had?
No, I just originally started off with that interesting conundrum about, because I'm sure at some point it's going to arise that if you have unvaccinated guardsmen that are healthcare workers, how can they do the job?
No, it's a great question, and it's a really difficult question, and you're right. And we should be asking this. And but let me let you go, because you made a great point, and I thank you for giving us a call in and sharing some time with us and sharing your thoughts.
Thank you, Michael.
No, you're very welcome.
All right. Have a good night.
You too.
Bye-bye.
Bye-bye. So, folks, you've been listening to a lot of the conversations we've been having with people from Dutchess County, from Pennsylvania, from Broome County. People are calling in. They have the same concerns that you have. They're worried about the conclusions, the consequences of the actions that are being done by our politicians that are half-baked, that they have not considered what happens. They're making a decision for today and not considering what happens tomorrow. They're not thinking about how this is going to negatively impact your life, in your community. They don't seem to care. They don't seem to have stopped to think about this as they give out exemptions to some of their favored people, some of the people who make the most donations to them politically. And if I'm wrong, I'd love to hear any of these politicians explain to me why I'm wrong. But they're giving these exemptions to their friends who politically help them, and everyone else they're taking a dump on. They're kicking us down the road as if we don't exist. This is the problem that we're seeing right now, and it's very, very aggravating. And I can tell you, I'm absolutely incensed about this stuff. And the thing that I really want to end on is, and to the news media that are, I know many in the news media as well as politicians watch this program. I'm sure someone's watching this from several of the major news media outlets in my region, if not around the nation and around the world. And I want to ask you guys, why aren't you asking these questions? Why am I the only one asking this? I know some of you guys. I know some of these news media outlets, the national, the local. I know some of these reporters. I know some of the executives. And I'm asking you guys, why am I the only one doing this? You guys aren't stupid. I know sometimes you do stupid things, but I'm asking the mainstream media, why are you not asking these questions? Because I know you know these questions. Some of you have had conversations with me about these very same questions, just like the politicians. And you have my phone number. You know me, some of you personally. You have my email, some of you. You have my private contact information, some of you. Why are you not, you've had this conversation, some of you. And I have to ask you, why are you not asking these questions? This is the job. Yes, I'm a political commentator. They're reporters. They're journalists. They're news radio talk hosts. Why aren't you guys doing your job? Why are you not asking the questions? And you know what? You don't have to ask me. Why aren't you asking the elected officials, the very same people who are making these policies and saying, this is Swiss cheese. You just showed us Swiss cheese. It doesn't make any sense. Explain yourself. Kathy Hochul took 2 days to come up with a plan that is Swiss cheese. I'm going to take people from one place and I'm just going to move them all around the state, which doesn't fix the problem. I'm not the only one to figure that out. I'm not that smart. I wish I was. It's not that hard to find that hole in her plan. Why is the news media not asking this question and demanding that they get an answer? Because if there is an answer, everyone will feel better. It will be good for the state. It'll be good for the politicians. Please answer the question and make me feel better. And stop me from asking the question, because you'll answer the question and everyone will know that their health care is going to be okay, that their economy is going to be okay, that their neighbors are going to be okay. But you're not telling us that. You're not asking the question, which is the job of the news media. It's not your job to pat Kathy Hochul on the back and go, good girl, what a great job you did for the party. Your job is to say, there's a hole in your plan. It doesn't work. Explain how you're going to fix that. Because this is a big deal. Tens of thousands of people are going to be affected. And I don't just mean the 40,000 or more healthcare workers in New York State. They all have families. They all have jobs. They go to and from their job. They go to restaurants. They go to bars. They go to the local department store. They buy things. They get gasoline. They pay their rent. They pay their mortgage. They pay their taxes. If you think the only people being affected are doctors, nurses, and healthcare workers, then why are you in the news industry? Because that's obvious. It doesn't stop there. And if you're a politician, you are blindly doing some politics, some partisanship here if you're not understanding that this affects tens of thousands of people besides just doctors, nurses, and healthcare workers. This is affecting everyone in this state, and to a certain degree, everyone in this nation, and to a certain degree, everyone in the world. There is a ripple effect. It doesn't stop just here. And if you're telling me that tomorrow we're going to have a bunch of National Guard people that are suddenly all organized, all with locations that they're going to show up in, because we already know all the places that have problems where everyone's leaving, you can't tell me that. I've only just at 7 o'clock this evening figured out through sources and from phone calls and news, figured out that there's about 1,000 healthcare professionals that no longer exist in Broome County alone. What's the number for Oneida County? What's the number for Delaware County? How about Shenango? How about Madison? How about Cortland? How about Tioga? How about Dutchess? We can keep going. Rensselaer. We can keep going. How many counties? Can you tell me what the number is in each and every county? No. And guess what? Neither can Kathy Hochul, which means that tomorrow there is not going to be a bunch of doctors and nurses taken from the National Guard, picked up from the Bronx or Queens or from Albany or from Syracuse, and they're going to show up in Broome County tomorrow to replace all of these people and therefore take care of the 100 people per day, per location, per hospital, 500 people in Broome County alone that are going to be needed every single day. So you can't tell me you thought it through. And yeah, that's why we should protest. That's why we should fight this. This is why we need to get answers. Because it seems the only way to get them to pay any kind of attention to this is to protest with 1,000 people showing up, screaming in front of City Hall, in front of our politicians, in front of the hospitals going, you're destroying our community, our state, and our nation. And even then, it's a battle because you guys fight us. You won't put it on the news, and you hide it from people on social media, and you shut down channels on social media for actually asking the simple question. It's very aggravating. Teresa mentions, besides protesting, what are the best ways to get our elected officials to listen to us? And I'm glad you asked that, Teresa. You send them a letter, you make a phone call. Not one or the other, you do both. You send a letter to every politician. It can be the same letter. Just write one letter once. Asking them you can ask them the questions I've asked. You can ask them what your questions are. You can ask them anything and say that you need to have an answer. Or else you will not be voting for them, or else you won't donate to their campaigns, or else you will find another way to replace them. Or you will leave the state, and the state will lose the taxes, the state will lose the business, they will lose the income, and another state will gain it. Because thank God in America, we can still travel until they give us a vaccine passport, which means we won't be able to go anywhere. But until they lock us into place, into states, so that before they prevent us from going to anywhere else, before United States becomes New Zealand, literally shutting down the country because one person got COVID. One. Didn't die. One person got COVID. One person caught COVID. They shut down an entire country. Before the United States becomes that, people will move. That's the threat. Send them that letter. Then make a phone call. Ask them the question. Say you want to have an actual answer. And say the same thing that you said in the letter that you sent out. Let them know you're serious. And then after, and only after that you've sent out the letter, only after you've made a phone call to your politicians, then go on social media and say, and here's the letter that I sent out. Here's the message that I sent to them. This is who I sent it to. And here's their answer. Whatever their answer is, don't make up anything. Quote them exactly. Record it if you have to, so that you can put in exactly what they said, so that everyone knows. And if we have 1,000, 10,000 people in New York State alone that actually do that, these politicians will change. They will be scared. They will run for the hills to do whatever it takes to answer it, because they're going to be terrified that they're going to be out of a job in either this November or November in 2022 or November in 2024, whatever it may be. And they want to keep their jobs. They want to keep their cushy, very expensive, really high pay, full of perks job. They want to keep it desperately. So they will get something done. So to answer your question, Teresa, call them, send them a letter, quote them on social media after that, letting everyone know what their answer is. Embarrass them. Politically, embarrass them. Hold their feet to the fire. Just as I have done today, talking about County Executive Jason Garnar. Not because I think he's a bad guy. I know Jason. Like I said, I know him personally. He's not a bad guy, per se. He's just a politician, and I'm picking on his political actions. Kathy Hochul, I don't know the woman. I don't know if she's a good person or not. I'm not picking on her as a woman or as whatever political party, and I know which one it is, which her political party. I'm picking on her as the politician who's supposed to be taking care of New York State, and she's not. Reach out to them. And I would say the same thing to Donna Lepardo, the assemblywoman. There's our state senator, who's not going to be state senator in a little while, so I'm not going to mention him. And I've said this about, Antonio Delgado, New York 19th, which is going to be Broome County is going to be part of the New York 19th. So he's going to be our representative. I'm waking him up to the fact that, hey, we expect him to have answers. I've spoken to Claudia Tenney. She actually responded. I spoke to Police Chief Zukoski. He responded. I have nothing, I'm not going to be mad at the people who gave me an answer, and the answer wasn't a good enough answer, but it was the answer that they had. I can respect Chief Zukoski. He's not going to arrest people at Lord's tomorrow like Lord's wants him to do. He's not a security guard. He's not here to intimidate the public. I respect his answer, and we all should. I respect that Claudia Tenney is working on this, that she has sent her representatives as she's in Washington, D.C., and she's voting on the bills that are affecting our life, that she sends her staff down to the protest and says, hey, I'm with you. I know what the problem is. I've heard you protesting. I've heard your questions. I've heard what you're saying, and I'm trying to get an answer. You know what? Is that perfect? No. Is it an answer? Yes. Is it an answer that's positive? Yes. Do I respect that? Absolutely. So should you. Do you have to agree with her personally? No, not at all. Didn't ask you for that. Don't care. Do you have to agree with me? No, you don't have to agree with me 100%. I don't care. I'm not here to make you do what I say. But if we want to make this better, that's how we make it better. Michael Bowie says, I would love to see you on WNBF in Bob Joseph's old spot. WNBF, for those who don't know, is the only talk news radio program in the southern tier of New York. It broadcasts out of Binghamton, New York, and I think it has 30 or 60 miles of coverage and zero competition. And therefore, they can get away with not covering the news, not talking to people, and not paying attention to the issues, and pushing out propaganda. That's my personal opinion. I've been on the program before. I've spoken to Bob. We used to be on friendly terms. We haven't been for more than a year, actually 3 years now. And I don't support WNBF because of the actions that he's taken. And I disagree with what he edits out, the way he silences the public, the way he tries to guide people to his mindset and doesn't even consider that there might be another mindset. And the fact that he is not covering the news, that really matters. When you have hundreds of people showing up week after week, you know what, Bob? You should have been there at least once. Should have talked to some people at the spot. Done at least one interview. At least one. But they'll never put me on WMBF. Mike, they won't ever do that. Because I don't have the same political preference as Bob. I don't align myself with the politicians in their political preferences. I'm not the one running around screaming that, this president good, next president bad, blindly. And I'm willing to ask people questions in positions of power and hold them accountable. They will never let me on that. They will never let me do that. That's why I'm not on the show now. They don't have me on the show now. Why? Bob knows my phone number. Bob knows my email. Bob Joseph could have me on his program to do an interview in 5 minutes if he wanted to. And he won't. He hasn't for more than a year because he doesn't care. Please remember, folks, Broome County, there is going to be a rally on October 9th from 3 p.m. until 5 p.m. It's on a Saturday. It will be downtown Binghamton by the courthouse. Please do attend. Please support that. Please help us ask these questions of our politicians, and let's ask them to give us actual answers. Not some fluff, not a run around in circles, not a smoke and mirrors, an actual answer, an actual plan. I'm not asking for the perfect plan. I'm not asking for the best plan. I'm not even asking for an okay plan. I just want to hear an actual plan. An actual plan. Not smoke and mirrors, not distractions, not political gamesmanship. Just a plan. Something that we can all work with. Something that we can all live with. Something they don't want to tell us at all. And by the way, folks, if you've made it this far, please, and I hope you've shared this with people. I hope you've liked it. It helps a lot in what I'm doing here. It helps a lot to ask these politicians the questions and getting answers. The more that you guys subscribe, the more that you like and share, the more that you comment, the more these politicians are going to say, oh, wait a minute, Mike just asked the question. No Soundbites Allowed is asking the question. We have to answer them. We have to give him an answer because otherwise he's going to hold our feet to the fire, and people are going to see that, and they may not vote for me. They may not donate to my campaign. You know what? That's the tool I want to be for you. I'm trying to get them to answer you. I'm trying to make sure they're doing the right thing for you. So please do subscribe if you can. And with that, I want to thank everyone who's called in. I want to thank everyone who's made a comment. I want to thank everyone who watched this, even for a little bit. Whether you agree with me or not, I'm thanking the people who don't agree with me just as much as those who do. I thank you for taking the time out of your life on a Monday to not watch football for a little while, to have this conversation about our community, about our people, because I love our community, I love our state, I love our country, and I'm worried. So I thank you for taking some time with me, and I will have more coverage on the vaccine mandate protests. I will have more coverage about what's happening to our country, as well as the other content that I do. And just as one final reminder, tomorrow at 11 p.m., and then again at 6 p.m., I will be at SUNY Broome. I am part of the Civic Engagement Board, and they are having a Right to Vote National Voter Registration Day. We are having an event at 11 o'clock until 12, 6:30 until 7:30. I am part of the event. We're going to help people know about their voting rights and knowing about petitions and how to influence and make a difference in our nation. It's nonpartisan. We're there just for information, and I hope you will join us at 11 and 6:30 at SUNY Broome. I thank you for that. With that said, I want to thank you all for taking the time to be with us here today. I hope your team wins in the football game. I hope you're going to be healthy and well. I hope that our doctors, nurses, and healthcare workers are back to work as soon as possible in New York State, in Broome County. And until the next time, folks, I want to thank you one final time, and I want you all to